Basal cell carcinoma, what that tiny spot on your skin might be hiding. Have you ever looked at a spot on your skin and thought, oh, it's just a pimple, or it's just a scratch that won't heal? Maybe even a shiny little bump you keep ignoring? Well, that might be nothing. But it could also be basal cell carcinoma, the most common form of skin cancer in the world, and one of the most underestimated. Before we dive in, tell me, which city are you watching this video from? Drop it in the comments. I'd love to know how far this message will travel. If you appreciate health content that brings science, awareness, and practical wisdom together, go ahead and like this video, share it with someone who needs to hear this, and subscribe to our channel. That's how we grow, together and informed. Now, let's get into it. Basal cell carcinoma, or BCC, for those familiar, is the most frequent skin cancer type out there. And ironically, it's also one of the most ignored. It starts in the basal cells of the epidermis, the outermost layer of the skin. Although it grows slowly, it can still cause significant damage if left untreated, especially when located on areas like the face, nose, eyelids, or ears. Many people brush it off because it's considered less aggressive. They delay seeing a doctor, apply random ointments, or just wait for it to go away. But here's the reality. This so-called harmless spot can grow, invade deeper tissues, and cause real harm. So, what causes it? The main culprit is cumulative sun exposure. You know that golden tan from your youth? Those hours under the sun without sunscreen? They may come back to haunt you years later in the form of what seems like a harmless lesion. Common signs include a shiny, pearly bump, a red nodule with visible blood vessels, a sore that doesn't heal, a scaly patch or crusty area that bleeds easily. If you notice a persistent change on your skin, don't ignore it. Another common myth: it only affects the elderly. Not true. We're seeing BCC appear earlier and earlier, especially in those who had intense sun exposure during childhood or adolescence. People with fair skin, light eyes, or a family history of skin cancer are at even greater risk. Now, here's the good news. Diagnosis is relatively simple, and treatment is usually highly effective when done early. A dermatologist can examine the lesion and, if needed, perform a biopsy. If it's confirmed to be basal cell carcinoma, surgical removal is the most common treatment. Depending on the size and location, doctors might opt for conventional surgery, curettage with cauterization, or even Mohs surgery, which removes the tumor with precision and saves as much healthy skin as possible. In certain cases, when surgery isn't an option, other treatments like cryotherapy, topical medications, or photodynamic therapy can be used effectively. But here's the core message. Early detection saves you from bigger problems later on. When caught early, the cure rate is close to 100%. And what helps? Getting to know your own skin, doing regular self-checks, paying attention to new spots or any that change shape, color, size, or texture. Picture this. Someone who works outdoors for years, a farmer, a fisherman, a gardener, notices a little sore on the nose that just won't heal. They think it's irritation from the sun, use some cream, but months later, it's still there. They finally see a dermatologist and discover it's basal cell carcinoma. Thankfully, it's still in the early stages and is successfully removed. But that scare becomes a lifelong reminder. BCC might be the nicest of skin cancers, but it should never be ignored. The earlier you catch it, the easier and less invasive the treatment, with far fewer risks of complications or scarring. This video is for informational purposes only and does not replace medical advice. If you've noticed something unusual on your skin, don't wait. Make an appointment with a dermatologist. And now I want to hear from you. Have you ever had a skin check? Do you know someone who's had basal cell carcinoma? Share your story in the comments. Your words might inspire and protect someone else. Yellow heart. If this video resonated with you, leave a like, subscribe to our channel, and hit the bell icon so you don't miss our next content. Together, we can take better care of our health, one spot at a time.